So welcome. My name is Ya. This is my colleague Li. It's our third time in the LOC meeting here. We are always so glad to be the bridge between the Chinese and Western medicine. I have a lot of Western doctor friends. When we talk about Chinese traditional medicine, a healing method over thousands of years, I often hear they ask with that suspicious look, how does that really work? Are you really sure it's not because you're a lady, nice lady, you have the placebo effect? Or, yeah, right? Or because your intentions are pure, so it turns out well? No. Traditional Chinese medicine is more than a method, it's a way of thinking. Therefore, I will introduce you a short video. Let's have a look. Okay, so what is the message of this video? To me, when we are so sure about what we see, what we know, we are in the same time so blind for what we don't see, what we don't know. This makes me anxious. That's why I have never stopped learning. I studied Chinese traditional medicine, Western medicine, biology science, fascia therapy, frequency method, and I also energy medicine, sport medicine, even anthropology. Though there's still a lot in my wish list. However, I then realized these are great tools. But most important is through using this tool, we truly understand how we observe life, how we understand disease, and how we explore the unknown from the known. Today, I would like to share with you my blueprint of healing. And you will see, for better or worse, how I think. So taking you back to the very first TCM lesson in my university in 1999, we learned basic characteristics of traditional Chinese medicine. It says the concept of organism as a whole, diagnosis and treatment based on an overall analysis of signs and symptoms. I know I feel the same as you guys feel now. It sounds nice and probably correct, but what does that really mean? It took me 20 years to figure that out and apply them to all my treatment. I rephrase them to holistic and seeing through. Being holistic is about standing higher when looking at a bigger picture. It is not only about finding the tension from the ankle to solve your neck pain. It is more than that. Any past injury, surgery, trauma you went through, but also the genes you carry, the environment you live in, and the medication you take, that all counts. Being holistic is also a harmony of knowledge and practice, a unity of knowing and being. Healing is the opportunity and process of going home. Putting the tissue back, healing the unhealed parts from the past, building consciousness and connection to the nature, others, and yourself, maintaining a healthy lifestyle. I will start with two examples. Let's talk about bone spur. What causes bone spur? In school, we learn bone spur caused by joint degeneration and joint inflammation from constant muscle tone. There is a better explanation, the Wolff's Law. It says constant tension in the periosteum will result in calcification of the ligament or tendon. Okay, But why is that? Why is there a constant tension? It could be a scar tissue. A scar tissue is inelastic tissue which can glue few layers of fascia together. That can cause a tension. It could be from an injured nerve. A muscle will stand up to protect a nerve being stretched, because your cerebellum will never risk the fellow nerve. When this nerve is injured, it will adhere to the fascia, and then the cerebellum will inhibit or will do anything to not let that muscle strength. A twisted joint. Think about our body architecture. It's like one piece of wetsuit dropping on the skeletal system. Anything make a twist, our body make a counter twist. Anything is twisted becomes shorter. Anything shorter creates a pull. That's physics, right? Okay. So now think about the wetsuit as the layer of the periosteum. So if this is the bone, the periosteum is like a skin outside of the bone. Whenever the tension comes, the periosteum will form to the direction of the tension. And we know we have the osteoclasis is destroying the bone all the time, and osteoblasis is reconstruct the bone. So when the new bone reconstructed, it will form to the direction of the periosteum. That causes the bone spur. So how we treat bone spur? Yeah, find where is the tension and release it, right? So if you are a manual therapist, you can palpate to find the tension. And these are tension patterns we know now from the anatomy trains. There are myofascia chains. We often see there are two or more than two tension lines are merged together. That makes more difficult for your body to compensate. I have treated a lady with heel spur, and I find the tension from her C-section scar tissue, and her injured knee and injured coccyx. When I released these three tension forces, her pain was going away in 60 minutes. That also makes me rethink if the pain comes from the spur, is really come from the spur or come from the tension. Okay. In traditional Chinese medicine, we observe the similar thing with the myofascia meridian. We call it Jing Jing. You can see in the picture, there is 12 myofascia meridians which are linked with 12 organs. You see, the anatomy train and 12 meridians, they are really similar. The similarity of it, you see the superficial back line with the bladder, urine bladder, and then the superficial front line with the stomach, lateral line with the gallbladder, the superficial back line with the triple warmer, the superficial front arm line with the pericardium, and the deep front arm line with the lung. And you have more. And you really can see these two systems overlapped. Okay, so we have a system to diagnose and treat this problem via a special post-diagnose. It's called the 9-pass diagnose. Through this small area of your wrist, we can find out which chain has abnormal tension and have treatment accordingly. Post-diagnose is like a scanner to your body. So when you have abnormal tension in the body, you will find abnormal post-tension, post-pattern in this area accordingly. See, that's the 12 meridian to put into the hand. That's how we discover where is the tension by post-diagnosis. Ehlers-Danlos. I have no idea what is Ehlers-Danlos until I took a course in States from Dr. Carolyn McMaken for the frequency-specific microcurrent. And I realized this is one of the biggest puzzles missing in my blueprint. Ehlers-Danlos is a genetic connective tissue disorder resulting from collagen defects. The connective tissue is in the skin, joint, digestive system, disc annulus, blood-brain barrier, organs, gums, eyes, almost everywhere. People with Ehlers-Danlos syndrome will have frequent dislocations, subluxations, easy bruising, chronic pain, prolapse, gastrointestinal issue, hypermobility, TMJ, fatigue, organ rupture, POTS, slow healing, depression, anxiety. Look at these symptoms. These impossible patients do walk into our practice, and they often told it's in their head, but it's probably not. So you will see in Ehlers-Danlos patients, they have an increased range of joint movement, stretchy skin, fragile skin that breaks or bruises easily. You can do genetic tests. There are 13 subtypes of Ehlers-Danlos. But the easiest way is to do the Baton score test. And you ask them to bend their finger, and their thumb can easily touch their arm, and lift their pink. Their pink is more than 90 degrees. Grab the skin, their skin is over here. Or just observe their knee and their elbow position. Here you can download a published paper for Ehlers-Danlos from www.ehlersdanlos.com to understand why almost all the Ehlers-Danlos patients has depression or anxiety. Oops. Okay. So think about the legs gut basement membranes is structurally connected to the vagus. So every time when the patient stand up with few pounds in the food or stool in their digestive tract, they make a traction injury for the vagus. And the vagus nerve is the one who tell your brain there is a tiger. So their middle brain just get jacked up. That's why these patients always anxious or have a depression. Okay, here is a story, a review from Acuherb Google page from one of my patients. I'm going to read it for you. For 22 years, I have been struggling with anxiety disorder and many other symptoms related to this disorder, such as depression, chronic diarrhea, severe muscle, chronic pain in the whole back, sleepless, panic attacks, feeling constant stimulated by the surroundings. I could only feel a bit better alone in the nature doing walks. My quality of life was very low. When I came to Ya, I rated 2 out of 10 because I just survived. I couldn't sleep because I was hyper alert and I couldn't rest either, as I was heavily tense 24/7. My nights were horrible as I had often panic attacks that could wake me up with heavy sweating, then ice cold. My nights were exhausting. I couldn't appreciate any beautiful moment because I was 24/7 turned to fight or flight. Being in such a state of mind for too many years made me develop anxiety and depression. And believe me what I said, I tried every treatment. Unfortunately, nobody realized I suffer from PTSD. When I came to Ya, she directly noticed I had experience with spinal trauma, and we figured out that was due to a car accident 23 years ago. Until today, I don't understand how she noticed it, but I truly don't care because she healed me. It took 3 sessions to feel a real change. No more diarrhea. My sleep was deeper and deeper. No more anxiety during nights. No more sweating. After 4 sessions, I feel so much calmer and peaceful. Okay, so when I examined her, the first session, her tight, deep cervical muscle like a rock, and her patellar reflex is hyper. It's a +3 patellar reflex. And that told me that she had a spinal cord sensitization and probably a spinal trauma. Why? Because the deep cervical muscle is tensed up to protecting the inflamed spinal cord. That's why the inhibitory signal from the brain cannot pass through on time to dampen the patellar reflex, right? And her 24/7 stress response showed her brain sensitization. What she didn't mention was that she has 7 out of 9 in the Baton score. It was the 3rd session I noticed that. And since I treat her aorus downloads, that changed everything. We had a great tool, the frequency-specific microcurrent, to target and to treat the tissue, the connective tissue, and also to treat the spinal cord and brain sensitization. The fact she will have to come back once in 6 weeks because it's genetic. I cannot fix the genetic part, but with the acupuncture, FSM, we can manage to get her a good vagal function, pain-free, and emotional balance. In TCM, I find for Ehlers-Danlos patients, they usually have a spleen and kidney energy insufficiency through this 6-position post-diagnosis. It's another post-diagnosis. For Ehlers-Danlos, it's never easy, but never not work. You are all specialists, so you probably know more than I do. If you have ideas to treat connective tissue, let me know. Seeing through. Seeing through is the first principle thinking, seeing through the symptoms that seems unrelated, but are actually related, and find the first domino in the chain reaction. Let's talk about shoulder injury, shoulder pain. People usually come with a diagnosis with bursitis, partial tendon tear, tendonitis, right? So what is the first domino then? There is a muscle here called subspicularis in the shoulder plate. Span its life shortened. Why? Look at all your position. Your arm is all internal rotated and adducted, right? So that's the position we hold. So the subspicularis nerve is then get irritated and inflamed. And inflammation causes adhesion. When the nerve adhere to the fascia, your cerebellum will never allow this to lengthen because they won't put the fellow nerve in risk to be stretched. Right? So, think about it. If you are the cerebellum, what you will do to protect that nerve? You will inhibit the external rotator and abductor, right? What muscle is it? Infraspinatus, supraspinatus, and teres. These muscles are the antagonist muscle of that muscle. So when your cerebellum wants to protect that nerve, they will inhibit these muscles. So you often hear your patients say, "Doctor, my arm is so weak, I cannot do it. My muscles are weak." It's never weak, it's inhibit. Okay. Look at this. When we abduct and external rotate our arm, our humeral head will slide down. But it didn't slide down by itself. It slid down by the muscle contraction from that three muscles, infraspinatus, supraspinatus, and teres. But they are inhibited. So every time you abduct your arm, your humeral head just smash to the capsule. That's why you get bursitis. And when your muscle has less strength and you will have to catch a ball or do a sudden movement, usually the muscle takes the hit. But now the muscle is inhibited. Which tissue takes the hit? The tendon. So that's why people get tendonitis and partial tendon tear. So here is the chain reaction. What is the first domino? Is the subspecularis the first domino? Very close, but not yet. Think about the architecture of our body again. We have the vertical axis, which is dominated by the legs and the feet. We have the horizontal axis, was dominated by the arms and hands, and the anterior, posterior axis dominated by the spine. These three axes will merge somewhere in the body, and mostly it's merged to the lower cervical vertebrae. We know the C5, C6 nerve root innervate almost all the muscle in the shoulders, right? So the first domino is not even the C5, C6 disc, but the different tension force come from your body. We can use different tools to treat it, but most important is when you can see through, body can tell you everything and guide you to find the first domino. Trauma. Let's talk about trauma. A few months ago, I have treated a lady who came because her toes is broken from a door falling on the foot. And when the fracture is healed, she still couldn't walk, and she couldn't put her weight on the foot. As usual, I did a treatment with acupuncture, fascia therapy, and FSM, which took away 80% of the pain. And then I hear she said, "I feel so nauseous when you work on my foot." Really? Why was that? Dr. Carol from States said once in her course, she said, when people have the hemo, they feel nauseous. It's not coming from the stomach, it's coming from their brain. And the trauma always has two parts, the trauma itself and the shock of it. So I did another 20 minutes of treatment for that trauma. In 20 minutes, that 20% of the pain went away. So I asked her, what really happened? She said, "Oh, my husband and I just fixed the door, and the door fell down on my foot because he just released his hand." "Okay, how you feel about that?" "Oh, I'm still so angry, I couldn't talk about it with him." You see, it's a trauma. So remember the limbic system and the vagus. Vagus is inhibited by the infection stress trauma. When there is infection stress trauma, your middle brain thinks there is a tiger and will turn vagus off because the vagus stimulation gets in the way during the survive situation. When the tiger goes away, normally the vagus should turn on again, but it's not always the case. There is a very interesting book called Why Zebras Don't Get Ulcers. The minute before, the zebra is running chasing by a tiger, but the next minute, they are eating peacefully on the grassland. Animals, they will turn on the vagus again when the danger is gone, while the human brain could feel the danger is always present and make the body highly alert. That's central sensitization. Our middle brain, the limbic system, is not only a stress center, but a memory bank. The hippocampus remember all bad things happen in our life, subconsciously, unconsciously. Why? To protect us next time when you have the same situation, you will run fast. But when people have a prolonged stress or an overwhelmed trauma, their limbic system will stay on even when the threat is gone. So how I treat trauma? I define trauma as a scar tissue in the limbic system, and I wrote a sequence of frequency to work on the deep limbic system while I'm using post-diagnose and the neuro-linguistic program. Think about it. Who on the earth don't have a trauma? If we can change the input of it and then change the output of it, we can maximize our potential and maintain a very, very strong and stable inner strength. Trauma is the first domino of many, many, many cases. I have treated so many addiction problems. When I start to understand they are just trying to have that short, quick break from being chased by a tiger all the time, I search for trauma. It's a game changer. In TCM, we have another post-diagnose, which called left 人迎 right 气口 post-diagnose. I have no idea, thousands of years ago, how our ancestors figured that out. Through the left 人迎 pose, we could verify the external factors, which we know now is the right brain response. More for defense, more for explore, and more towards the unknown. While the right 气口 pose, we verify the internal factors, especially for the 7 emotions, which we know now is the left brain response, more for order, close down to a certainty, more towards the known. When we treat trauma, the internal factors will show which emotion the trauma is linked with, and we can treat it accordingly. My healing blueprint, my favorite part. Let me show you my healing blueprint. In Chinese, we call it 精气神. And if I translate it to 精 means essence. That's the physical body, the structure. In quantum physics, we call it particle. We provide with the fascia treatment. Qi means energy, the functional body, the flow. In quantum physics, we call it wave. We provide it with frequency-specific microcurrent. And Shen means spirit. I understand it as a life force or life status. It is most important and unique in traditional Chinese medicine. It is about as a life in space and time, between the heaven and earth, go through the 4 seasons, how life feel or responds or optimize. We call it, in quantum physics, the particle-wave duality. We provide it with acupuncture. What makes it duality is actually us, the therapist, which is part of the healing process. If all the symptoms are the struggles of life, then being seen is a door open for healing. Just think about it. When a little girl is crying in front of you, will that make a difference if you hug her just because she's crying, or you hug her because you understand why she feels hurt? For me, that makes a big difference. We could use whatever knowledge we have as a tool But what really makes the difference is the understanding, or we call it wisdom, to heal one life with another. Time to play. Let's do the demo. At the end, what can a goldfish teach us about the nature of reality? Because it lives in a round bowl of water, a goldfish sees a distorted picture of the outside world. It could have a different picture of reality than we do. But how do we know we have the right picture? We might also in some giant goldfish bowl. There is no unique picture of reality. The goldfish's view is as valid as our own. Well, this is not from me. That's from Stephen Hawking, the ground design. And in China, we have something similar from the Diamond Sutra. 诸相非相，如见如来. Literally, in my context, it translates to the things one see, one know, plus the things one doesn't see, doesn't know, is the truth. So, I wish while we are all pursuing the truth, we could work together. Because when we are together, we carry things that other people don't know. And we were together, we will be more and more close to that truth. Voila! Thank you to all my teachers who made it possible for me to pass this knowledge and their experience. My teacher Fu Songqing from Osaka, Japan, Dr. Caroline McMaken from Portland, the States, and Dr. Lin Liangchuan from Taiwan, China. And all my patients, they are also my best teachers. And thank you, everyone. I hope you enjoyed. Thank you. Great. Okay. That's for today.
Thank you.
You're welcome.
Thank you all for the honor.